This segment is sponsored in part by One Brooklyn Health.
September is Sickle Cell Awareness Month, and here's a stat that might surprise you. Sickle cell disease affects about 100,000 people here in the United States, and more than 90% are non-Hispanic, Black, or African American. And that is a lot of information and misinformation out there about sickle cell. So here to help us separate fact from fiction are Dr. Kuzman Viswanathan, Dr. Marin Blackwood from One Brooklyn Health, along with Chanel Rice. It is lovely to see all of you this morning. How you doing?
Great. Thanks for having us.
Of course, there's a lot to get through, and I just want to start with some of the laying the groundwork. Dr. Viz, what exactly is sickle cell disease?
So sickle cell disease is a genetic inherited disease of the red blood cells in the blood. And as you know, the red blood cells carry oxygen with a substance called hemoglobin. So the hemoglobin in normal people is adult hemoglobin, while in patients with sickle cell disease, it's sickle hemoglobin. And they inherit the trait one from each parent. That's how patients have sickle cell disease. And the red cells, because they have an abnormal hemoglobin, they become sickle-shaped, which means they are hard, unyielding, do not circulate very well, which leads to all the complications of sickle cell disease, which essentially affects almost every organ in the body.
Wow.
So, but the cardinal feature of sickle cell disease is pain.
Pain.
And so it occurs suddenly and can be very disabling. But there are other complications like strokes and cardiac complications and lung complications.
Sure.
The good thing is that it's diagnosed at birth with newborn screening.
Excellent, and I think we have someone here who can speak to that. Chanel, I understand that you've been receiving care from One Brooklyn Health since you were born.
Yes.
What has that been like for you?
So, of course, I was diagnosed at birth with the newborn screening program. But One Brooklyn Health have a comprehensive sickle cell program where they can see you from infancy through to adulthood. And most programs, you're either pediatric or adults, and it's really hard for adults to find hematologists that specialize in sickle cell disease. So they really do have a unique program that sees you throughout your whole entire life.
That must be comforting, or at least giving you some sort of knowledge that, okay, I'm with this same team.
Yes.
What are some of the misconceptions?
So some of the misconceptions is that, you know, sickle cell patients are might be lazy, they're drug seeking, which is one of the most biggest misconceptions out there, especially when receiving care, emergency room care, or care period.
Sure. Marin, let's talk about self-advocacy. How important is that, especially with something like sickle cell disease?
Well, self-advocacy is extremely important, Marisol. At One Brooklyn Health, we empower patients to be self-advocates. Look at Chanel. She's a perfect example of what self-advocacy can do.
What kind of support services does One Brooklyn Health provide? I know, Chanel, you started to get into it a little bit, but I wonder what you can provide us with.
So we do offer comprehensive care. So the important thing is for medical services, we have opportunities for, you know, transcranial Doppler to detect strokes, or to detect patients who are susceptible to strokes. We make sure we give them the latest disease-modifying therapies which are out there. In the last few years, we've had several. And then we also make sure that we can give them outpatient treatment so that they don't have to be admitted all the time. Right. And of course, if they need to be admitted, we are available 24/7 to make sure. And then there are social support systems like support groups and opportunities for them to know other patients, so that there is this support system that's built in.
That was fantastic news, fantastic information. Thank the three of you so much. And Chanel, congratulations.
Oh, thank you.
On being around and helping other folks who might be watching this.
It's also part of the program, you know, being with One Brooklyn Health for so long. They helped me gain the confidence to go out there and continuously speak on the behalf of sickle cell patients and spread awareness all over, not only for myself, but for other people that look like me. So,
well, thank you for doing that.
Thank you for having me.
For all of us in our community. To learn more about sickle cell disease and the services offered by One Brooklyn Health, scan the QR code on your screen or visit pix11.com and click on the Pix Partners tab.